Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners of the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook. And go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks. Well, welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today it's a huge honor for me to introduce Dr. Ken Judy. Dr. Judy, thank you for being on the show today.
My pleasure.
Now, some people may not know the total history of the ICOI, and I know you are, one of the legends in implant dentistry. So my goal for the episode today is to get the history about yourself and how you got started into dentistry and then implant dentistry. And then also break down the history and the beginnings of the ICOI, the International Congress of Oral Implantologists group, and talk about all the developments and things that have happened throughout the years and where we're headed in the future, okay?
Good. To talk about myself just a little bit, I graduated from NYU College of Dentistry in New York in 1968. And then I went on for 2 years to study biochemistry in the graduate school. And after that, 2 years in a surgical residency program, surgical prosthetics in the French and Polyclinic Hospital in New York under Dr. Isiah Lew. And that was the best training somebody could have had in implantology at the time, and as far as I was concerned. The field at that time was, let's say, it was very fragmented throughout the world. There were an enormous number of important people doing implants in South America, in Japan, and practically every country in Europe, but they really weren't organized. A group of individuals decided in 1972 that they would organize the ICOI so we could hold world congresses every year or every other year to bring people up to date on the most recent developments in implants. And I had the honor to attend that Congress and to become an immediate part of the ICOI as one of 3 board of directors. And the contribution has to be really recognized of dentists not from the United States, although we had a very big contingent of dentists from the United States at that first meeting in Paris in '72. There were also extremely important representatives from France, from Italy, from Germany, from South America, and again, from the Orient. And what was agreed is that we would organize ourselves and hold substantial meetings as often as it was humanly possible, I guess, and financially possible. And we just proceeded to do that. In 1975, only 3 years later, I was personally responsible for making sure that the ICOI became a nonprofit corporation, a 501c3 corporation in the District of Columbia. And the thing that is most important about that is, frankly, that you are not allowed any form of discrimination whatsoever and hold on to the 501c3 status. So since that period of time, that has existed. In 1979, I became chairman of the ICOI, and that carried on probably for almost 15 years, and I became very good friends with Dr. Carl Misch, who I presume everybody knows, who we all miss, and we decided that it would be a good thing if he and I were co-chairman in case anything happened to either of us. And what happened is exactly what we expected, except unfortunately Carl was the one that passed away. We then had an introduction into the United States, if you think about it, through Brannemark and the Swedish group in 1982. Now that was, if you really think about it, 10 years after the first Paris meeting. And yet everybody was told that 1982 was the beginning of implantology. And they were off by 10 or 15 years, because even prior to the Paris meeting, there were a large number of people around the world who were experimenting or utilizing various forms of implants, some of which have stayed with us to this day, others have not. It's a good thing to realize about the field that a large number of things come and go in the field, and they are tried on a experimental basis, on a commercial basis, and the field is relatively self-correcting, fortunately. What has happened now is we have grown into a several billion-dollar-a-year industry in dentistry, and the concept of having self-correcting entities such as companies that cannot market products that don't work, such as individual researchers or practitioners that utilize various forms of implants that find out that they work well or not so well, again, as part of that self-correcting mechanism. So today, for the first, not the first time, but importantly, is this concept of self-correcting, or really looking at ourselves strongly, not only scientifically, but academically, and then in clinical practice. And the ICOI really helps to do a lot of that. To give you an idea, the ICOI is an international organization. Most other implant societies are national organizations. And we, for instance, have members in over 100 countries. We have world meetings of the various component societies that make up the ICOI. We used to have them every 2, maybe 3 years. Now we have them at least every year. Originally, the first one, as I said, was in Paris in 1972. The next one was held in Japan, in Kyoto, at the university. And one thing that I remember from that always is the dean of the university at the time was in his 70s, and he was a double degree person in dentistry and medicine. And of course, didn't speak Japanese, he didn't speak English. But through translators, I asked him what he thought about implants, since I was relatively sure that he wasn't that much involved in them. And he said to me it was his philosophy that all flowers should grow in your garden. And that really has stuck with me over the years. And I have been able to look at a large number of different implant concepts or devices or materials that have come to make this a very dynamic field. We then had world congresses in Australia, in Italy, in Venezuela, in Argentina, just to mention a few countries, but we began to have them much, much more frequently, at least every year, because of the fact that more and more societies were growing around the world, and more things were discovered in the field that had to be literally communicated from an educational point of view to our members and to the members of these individual societies. One of the things that I think has been unique about the ICOI has been its, I would call its internationality. In other words, when we started a journal, there were, I believe, 7 or 8 languages that were used in translating abstracts of articles, so that we could communicate those things around the world. We still do that today. And we still have a large number of international meetings every year. For instance, if I were to look at just this year alone, we would have a meeting in Marrakesh, Morocco, which would be good for the North African and Middle Eastern communities as well as Europe. We then have an ICOI ASEAN Congress, not a World Congress. That is in Malacca, Malaysia. And then we have a World Congress, our 36th one, in Las Vegas, Nevada in September. But it gives people an opportunity to meet their colleagues from around the world. And this, to me, is incredibly important as far as the growth of individual practitioners in learning new techniques and making new friends and just getting the emotional support that they need to know that they are in a well-recognized field. Next year, we would be in Arizona, Costa Rica, Germany, and a World Congress in New York. And in 2020, we would be in Houston, Texas, and a World Congress in Sydney, Australia. The only reason I know these things is we have to plan our meetings 3 years out. That is a problem that almost every large society has run into. So we have quite a staff that is managed by our executive director, Betty Lucas, that enables us to find good hotels, good locations, to negotiate contracts and the like, so our people are getting good bargains in terms of room rates, so et cetera. And any society that is not willing to do that is in trouble. To give you an idea on the internationality of it, if I looked at our last president, it was Dr. Gerard Scortecci from France, and we always have officers in the society at that level stay with us for 2 or 3 years. And the idea is if they come up with some good ideas, they'll at least have time to see them through. And in about a couple years, our president-elect will take office, and he is Dr. Shinichi Suzuki from Tokyo, Japan. And it's, again, just to emphasize the internationality of the organization. I think that's very important. Another thing that we have been able to do, which I'm very proud of, was form IDREF, IDREF, which is an Implant Dentistry Research and Education Foundation. This was thought of, believe it or not, in 1993 by Dr. Carl Misch and Dr. Martha Fidesz from the University of Alabama. And typical of how the organization works, they thought it was a great idea. I thought it was a great idea. And I said, I tell you what, I'll take responsibility for making sure it runs well. So one of my chief responsibilities over the years has been to see that that entity is well funded, that we established a grant program, which is extremely significant, meaning this past year we probably will have given calendar year close to $200,000 in grants. And we have a program for students in the United States, and we try to encourage other countries to do it, where we present an award to whoever a given dental school would designate as the most interested person in implantology in the school as a student. So every year they receive, I believe it's $500, and then free attendance at one of our meetings and things like that. But again, it usually winds up being read at graduation and the like, and it not only promotes our organization and lets students know that we're there, but it also has been quite significant in terms of encouraging new people to be on our lecture programs. So we've set up various types of lecture programs for every meeting that we now have. One would allow commercial exhibitors to talk about their products for half-day segments, but it's all on one half-day. In other words, we don't occupy more than a half-day. And then we have a whole additional half-day on young implantologists, and this is basically people who have not been used to lecturing before, and we hope that a lot of those are developed because of our grant procedures. And I enjoy them, I think, sometimes the most of anything at our meetings. I love to go in and listen to what new young people are thinking, and they go out of their way to give excellent presentations. And then we have main podium speakers for 2 days at every meeting. And then the major meetings also have table clinics and tabletop presentations. Also, in the society itself, to my knowledge, we're the only society that has a division for hygienists, assistants, auxiliaries, and a full-fledged program for them at each major meeting that we have. And that has become very, I would say, effective over the years. And we find that we more and more have to keep on refreshing what we tell auxiliaries. And what is extremely noteworthy is the fact that the auxiliaries themselves are giving superb presentations way above and beyond what a lot of dentists give them. So it's a self-perpetuating educational concept that has worked very, very well. We have a large society in terms of just its basic organization. In other words, to give you an idea, for instance, we have a finance committee. We have an executive committee. Due to Carl's death, I have been chairman of the executive committee now since then. And I've also been the chairman of the executive committee and the CEO. It sounds very fancy, but it's just a lot of hard work. We also have a finance committee, an audit committee, because once you are one of those 501c3 societies that I mentioned, your regular books have to be audited by an individual accounting entity. We have a continuing education committee, and as I said before, an implant dentistry research and education committee, a compliance committee. Again, that's part of the problems that you run into with your 501c3 designation. We have an international membership committee where we try to identify people around the world in different countries that can help us by growing the societies internationally within their own countries and then becoming full members of the ICOI as time goes on. We also have a diplomate committee, which relates to how we select the individuals within the society that we would designate as our best and brightest in terms of training and experience, publications, etc. So it's a complex society. If anybody wants to know anything about it, the easiest way to know something about it is to go to www.icoi.org, and there's a home page in there that informs people about the whole society, what type of members we have, where we would have meetings, what our educational structure is for the coming year and for years in advance, etc. So it's a very easy society to get a hold of. The other thing that you might want to look at, but I think it's a good idea, for instance, there is something called the Greater New York Dental Meeting every year, and I have been an advisor for them for some years in terms of implantology. And to give you an idea, it's always held the beginning of December, but last year they decided they would continue something called the World Implant Expo. So within this overall meeting, the people that run that society considered the growth of implantology so outstanding that they felt the need to actually establish a separate meeting within a meeting. They called it the World Expo, or Implant Expo. But at that meeting, there are 52,000 dentists. There are 18,000 dental assistants and 5,000 dental hygienists, to give you a good idea. Now, participating in the World Implant Expo were 3 different societies with lecture programs that were scheduled, namely the ICOI, the AAID, the American Academy of Implant Dentistry, and the EAO, or the European Academy of Osseointegration. To give you a good idea what I mean about our not discriminating at all, when we report in our newsletter about the World Implant Expo, we also report the participation of other societies. If you look at the other societies, you scratch your head when you find out that they don't follow that. They'll report their activity only as if they were the only society that existed, and they will try and ignore as best they can the other societies. And that's a shame. So it's been that way for years in the United States, at least. And I can remember one time those same 3 societies met in Chicago for probably 2 to 3 days and could agree on absolutely nothing. And at the end of it, I said at least what we should agree on is that we should produce a directory of dentists that do dental implants, because that would allow the public to at least find out who they should be looking for to get good treatment. Couldn't even agree on that. So a lot of the current implant societies that exist around the world, or some of the more important ones actually, do not really work that well together, and it's something of a shame. Because they really should, because the people that would benefit most really are the public that we serve, as well as the members in the individual societies. Another thing that I think is very important that all societies do, and I sort of mentioned it, is that we evaluate dental implant materials, devices, concepts, etc., and report on them at various meetings. I like the fact that we do it around the world and have this outreach among societies around the world that makes it very important. And to give you an idea, in the past, I'm not sure whether you would remember it, but they had vitreous carbon implants. And they had a whole scientific stable of lecturers who would lecture on this and tell you the best things in the world about it. The only problem is it didn't work. And so a few years went by before it became common knowledge that it didn't work. We had the same thing with aluminum oxide implants. And I can remember Carl Misch and I having, quite a discussion about it. And the problem there was the material had to be used in such large size or bulk that there were very few applications for it. And then it had to be put into a receptor site in bone that wasn't accurately prepared, because it wasn't a screw form or even a blade form. It was like a square or trapezoidal form. So you had to freehand carve a receptor site in bone, and there are very few places where that receptor site could even fit. But again, it was an idea where a large number of scientists were bought, if you wish, by the companies involved, and they would swear to you that this was the best thing since sliced bread, and in fact it just wasn't. The same thing has existed, believe it or not, even today, where what exists are root form implants. In other words, they're basically cylinders, and they have some design concepts on their surfaces or general form that are different. And you have to evaluate these one compared to the other. It's not easy to do. But one of the things that we have found is that a lot of people have decided it's a good thing to coat implants. So all of the root implants that you have usually are threaded to some extent, and then they're coated. And it has only recently become clear that some of the coatings that were put on these implants actually induced periimplantitis. And they've had to be taken off the market or the like, or they, depends on the company, they just bury it and don't utilize it anymore. But again, that's part of the function of these societies. They have to present material on everything that's being used, and they have to give all of our members around the world a pretty good view of what actually is going on in the field. Because, again, it's an extremely dynamic field if you look at the millions of implants that are put in every year. And how about we ask you whether there's something you would particularly like me to address? I'll try to.
Sure. Yeah, no, I think you did a great job about, talking about the early conception days and, how the ICOI formed and kind of where its leadership groups are nowadays. You guys have a real strong direction, and I think that's what's given it such good purposes. You've had some very instrumental people involved in from the beginning, kind of nurturing the organization and help develop it and lead its growth, and I think that's amazing. Where do you see the opportunities for dentists moving forward with the ICOI? I know, there's a lot of training going on, and the Mish Institute, continues to train people yearly for implantology. How could someone best utilize the ICOI? I mean, what's in it for the practitioners out there, other than obviously you guys have the journals and you have the resources available. You also have the meetings. What's the best way for people to get involved?
Well, I think one of the things that is tremendously important is to have a society worldwide that recognizes the achievements of individual members. Because what we cannot do, as far as I am concerned, is be responsible for worldwide education simply because we're an international society. The other thing we would have to be very careful in doing country by country, are we going to take on the liability of having live surgery? And that, again, is a problem. But what is very important is if dentists pursue an educational track and they are able to do a large number of implants and be well trained and et cetera, have good mentors, that they should have somebody that recognizes what they have done. And we have two major ways of doing this. One is to have them become a fellow of the society, and the other one is to become a diplomate of the society. And those are really recognitions of the amount of work they've done, the training that they've taken, because I very much don't like to say one course can take care of anybody's desire and have them be a complete person as far as implants are concerned. So you have to have something like fellowship, which recognizes a fair number of credit hours training in implants, and we don't necessarily specify where they are from, but they should result in cases that are reviewable by a fellowship committee that says, yes, you're doing the right thing, we can see that, worthy of ICOI fellowship. On the other hand, when you do a large number of cases, when you're even teaching other people, the number of cases that you have to have completed, I believe it's on a 5-year basis. It's over 200 cases, and you have to come and take a very stringent written and oral examination, and then you can be recognized as a fellow, or a diplomate, I'm sorry. And that way, people are able to advertise to the public who they are. And as you probably know, historically, dentistry has not liked the concept of advertising a specialty that they haven't recognized. And the only problem with that is there's an awful lot of specialties that really need recognition and should have it. And the ADA has not been as responsive as they should, in my opinion. I hope you can say that because I strongly believe it. And for instance, if you look at something like plastic surgery, that has developed into an enormous amount of subspecialties, such as plastic surgery of the hand, plastic surgery of eyes, of the face, etc. And these entities, again, should have an analogous entity to implantology there that would encourage them to train in their field and be recognized in their field. And that, for the most part, has taken place in medicine much more so than it has in dentistry. The other thing that you really have to focus on, I think, in your training is that you must come to grips with the fact that there are certain types of cases which can only best be treated by a group of implant specialists or dental specialists in the various fields that we know, such as prosthodontics, surgery, anesthesia, which is one of those fields that needs recognition as a specialty, dental anesthesia, but is not through the ADA, etc., diagnosis, treatment planning, etc., etc. And I just think it's critical that people are able to say to the general public, this is who we are, this is what I belong to, etc. Now, I can give you a funny example. For years, I've been a fellow of the International College of Dentistry. About 2 years ago, I was made a master of the International College of Dentistry, much to my surprise. And then I found out that there may be 4 or 5 in the world each year, and that's it. So it made me feel very special, but it made me feel very special in terms of my relationship to my colleagues in the International College. I wasn't trying to utilize that designation to achieve anything professionally or financially, but it's a little bit different out there in the real world if we are not allowed to communicate or effectively advertise our credentials that we've worked very, very hard to achieve. So the ICOI really tries to do that as best we can, and we're constantly in a changing environment in that regard. But I think you will find if we had this conversation a year from now, that you would find that throughout the world there would be well-established mechanisms for professionally recognizing and establishing people's credentials in implantology. We're now working through it, and I think that's an exciting thing to come. But basically, that's something that we offer our people now, but what you have to look at is, do you run into legal problems depending upon states saying you can or cannot advertise a specialty, etc.? And I have always had the belief, which I think guides a lot in the ICOI, that as long as we tell the truth, it's legitimate. In other words, if I say I'm a diplomate of the ICOI, and that is truthful, and you can look up what that means, there's no reason in the world why that can't be advertised. And there's no reason in the world why that can't be utilized in talking to my fellow colleagues in the field so it can be exposed on a platform for the benefit of the profession and for the public, not for me particularly. So I think that's a whole area that people should be very comfortable with when they become ICOI members, that they will be honored and recognized well.
Yeah, I think it's important for professional development of the individual to seek those credentials, and I agree with you. There needs to be the ability to share the camaraderie with your colleagues, but also share that professional degree of excellence with the patients you're providing care for. It's to be certified in your organization takes a lot of work and effort and training that doesn't come easily.
So I'll also tell you the downside a little bit.
Sure.
Our fellowship and diplomate status are so well recognized that there are countries in the world that, I'll leave them nameless, where people actually reprint our certificates, reprint our logos, and advertise that these are for sale to people for 10 times what we would normally charge for it, and without any examination process that is at all similar to what ours is. And that's a disgrace. But it just goes to show you that different countries and different people have different concepts of what ethical behavior is. So that's something that we have had to pursue legally an awful lot to make sure that it doesn't get out of hand. And when we find it gets out of hand, we really have to treat it very seriously. And I hate to say that. I have the feeling that we have better things to do, but you can't let that type of thing happen. And that's all I can say about it. We do have a wonderful journal in implant dentistry. Again, we publish 6 times a year. It's highly respected as a research journal. Its editor, Mort Perel, has been a colleague and a friend for a number of years. And it's something that we're very proud of. And there are a lot of implant journals in the world. That's a whole nother blessing in terms of the field being so mature and well-developed that I subscribe to probably, at this point, 8 or 9 implant journals. I read them. And believe it or not, by doing that or by going to other countries, which I do all the time, I find out what other people are thinking and doing, and it's just incredible what's out there to be learned just about what we have now. And forget the future. It will get better and better and better as far as I'm concerned, but it's just a pleasure to be in a field like that, and it's almost like some of the fields you have in medicine in terms of how you go after diseases that are hard to get in front of, like cancer and things like that, but all of a sudden we're beginning to find out that that's happening. And I think the same thing is happening in the field of implantology, that we're getting to find out what is needed in terms of patient tissues, in terms of devices that we make, etc., and we can project decent longevity for our patients. And we can set up educational standards for members in terms of what they should know in order to make this happen. So it's a very exciting field as far as I'm concerned.
Now, Dr. Judy, you've been in implant dentistry since almost its beginning times, and
yes.
You've seen and done a lot of great things, and have seen a lot of evolutions over the years. What makes you excited about the future of implant dentistry?
Well, 2 things. I think, believe it or not, the methodology that is being developed to diagnose what should be done has increased tremendously. And these are devices that have been developed by the profession, for instance, cone beam CAT scans and the like. And by having knowledge of the information that you're looking at, you can predict how long cases last. And we can be much more sure of ourselves in terms of how we present things to patients. You just don't say, don't worry about it, it'll last for your lifetime, because most likely that's not true. But we have a much better grasp on how long the procedures that we're utilizing routinely actually will last. And we're developing alternatives to treatment and the second and third iteration of treatment that patients might need if some of the implants that we're doing in good faith don't last as long as we would like. So that makes it exciting. It's an ongoing process. It's if you wish, a cradle to grave process. It didn't used to be that. But today, to give you an idea, we can take children who are born with no teeth, virtually, create jawbones for them, insert implants, take them through their first few girlfriends, a couple marriages, a couple divorces, children, and then redo another form of implant because the patient is getting older. So that's one thing that I think is, it's very exciting to me because people have to be extremely ill or have extremely poor anatomical problems not to allow implants to work. And we more or less have found out what they are. We're constantly refining our knowledge in it, and it makes me happy from the point of view what I knew when I first started in this field, maybe for the first 10 years, that's probably 10% of what I would know today. And that's an amazing growth. And I see nothing to slow it down. I also see something that I am very much involved in is seeing it spread throughout the world. In other words, it's getting down to countries where the people are not all wealthy people who live in Manhattan and will buy Lamborghinis and all that type of stuff, but they're just common people with common problems in a number of countries. And I see the benefit trickling down to people that normally wouldn't be able to afford it, but now are being able to afford it because of the nature of it. So that's about how I see the future of it.
Yeah, I think the access of care and the technology and like you said, the blending of knowledge and the progression of knowledge has really made implant dentistry exciting. It's not just for the few anymore. It's into the masses, and it's a part of dental culture and society in a way that there's no going back. And I think that's exciting. We've got.
That's a great way to put it, by the way.
Yeah.
Wait, there's no going back.
Yeah, it's not a fad that's going to be. I know when you started in implant dentistry, I'm sure there was some battles just to get it accepted in the dental community and the medical community, and that was probably some of your earliest struggles. And now it's how can we almost regulate its growth because it's exploding so quickly.
I think that's very true, but I tell you something, Phil. Honestly, I was at that area in the field where nobody was shooting arrows into my back. I identify with somebody like Lenny Linkow, who was, as we call him, a pioneer, but he also was walking around with everybody shooting arrows into his back, and that's not a comfortable feeling. When I got into implantology because my knowledge of reconstruction and surgery through Dr. Lew, it was something that I automatically did. I automatically presented. So I grew with the field. I didn't have to fight people outside the field. And if you really think about it, the number of people outside the field that existed back in 1965 was huge versus today when everybody, for the most part, accedes to the fact that it works.
Yeah, it's been quite an evolution in your time, and I know that you're doing a great job in maintaining the future of implant dentistry. Obviously, the ICOI being a huge part in that, and you still being the main kind of driver for that.
Well, I have an awful lot of help.
Yeah, I know you do. You've got a great team. So, what do you see the future for the ICOI? Obviously continuing its path, like you said. Is the credentialing part kind of the big thing right now? And
well, I think that's naturally just going to happen. What I also like is the fact that because of, let's say, our fiscal solvency and who we are how we can affect other areas in the world. For instance, we are able to work very closely with a university in Guatemala called Maricon University. And they have built a first-class school with first-class implant treatment with people who have had their education and graduate departments at NYU to go down there to work full-time because they came from there. That's one example, but that's an example of a society which for the most part is not affluent, but they've done it right. And then you go to a society like Saudi Arabia, all of a sudden they don't need people to go over there and lecture to teach them about implants because they've already paid the price to send their students or graduate students outside of Saudi Arabia, learn implantology, and come back. Now that is maybe a 10 to 15 year process before it works. And it's costly, and you wouldn't want to know how costly it is. But it's very, very different from the situation in Guatemala, where as a society we can make a huge effect. And around the world, for instance, we are now making a tremendous effort in India and in Malaysia. We are making an effect there that we couldn't possibly have made, say, 15 years ago. But today we can, for a number of reasons.
So it's the continuation of expanding the reach of the ICOI because of the extensions that you have and getting the right people and the right training and the right information into the reach of the practitioners throughout the world. You see that as kind of the big difference being made over the next 5 to 10 years, you would say. Is that right?
I think so. I think what is going to be very well identified, particularly in the United States, is where are there great sources for learning how to do implants for the individual practitioner. And I could name a half a dozen of them at least in the United States. And it didn't used to be that way. And I don't want to mention a half a dozen of them because it's like advertising somebody. I don't think I should do that. But they're there now and people know it. And they're beginning to self-advertise. And for the most part, if you're not doing a good job, you'll be called on it awfully fast. And in fact, that's not what's happening. Most of the sick societies, or even more that I'm talking about, really usually institutes. They really do a good job. Yeah.
No, I think there's a lot of good places to get your training, but you want to do it in a continuum. You want to get multiple trainings. It's a lifelong process, and to be around like-minded people with leadership, like yourself. It's great that you guys are doing all the things in the world that you are, and I'm really looking forward to my pathway. I've become a fellow and am looking to become my work on my diplomat status, and I'm very excited about that, and looking forward to possibly meeting up with you at the next symposium. So I'm very excited about what the ICOI is doing and the leadership that they provided me on my implant journey. Do you think the meetings and the credentialing is the best place for people to get started?
Absolutely.
Yeah.
The other thing I wish you wouldn't do is misread our own literature. We try to make it very clear. For instance, one doctor read that for a diplomate status, he would have to have done 200 cases. And he packaged up all of his records for the 200 cases and sent them to my office.
Well,
which you have no idea how much space that took up.
Yeah.
But one of the things that we do, and it's important, we maintain records. So everything that comes into the ICOI in terms of things that would reflect well on patients, or not on patients, on members, it's on the cloud. We know what it is. We're going to know what it is 10 years from now. It's of tremendous value as far as I'm concerned, and members should know that they never have to worry about any of this information being lost. It's an investment on our part, but it's a good one. Root Dental Lab, to give you an idea, they keep, for subperiosteal implants, they keep the button for every case they've ever done.
Yeah.
So we keep our fellowship and diplomate applications for every person that's ever applied.
That's quite an exhausting resource just in and of itself. So
it is, but it's a pleasure to have it.
Yeah. So it's a great responsibility, and we're glad that you and the team that you guys have there are doing that for the profession. So I really appreciate you spending some time with me talking about the ICOI and your history about that. You've had a very distinguished career, and like I said, I really look forward to meeting you in person at one of the upcoming meetings, and really appreciate your time here today. I think people are going to enjoy hearing some of the stories that you have, and we look forward to the continued leadership that the ICOI has for implant dentistry.
Well, I'm not going to leave it in the lurch unless I just drop dead one day.
Sure, absolutely.
We've spent a lot of time putting in place people to succeed everybody. That's critical.
Absolutely.
And that, again, was really brought to my mind with Carl and myself.
Yeah, I know he's very, very well missed in the world, and
God, yes.
I know he would be still proud of what's going on with the ICOI, and it's a great place for people to be, and I push people to that, so I will continue to do that. And like I said, I'm very much working on my credentialing for the diplomate process, and really look forward to meeting you in person at the upcoming meetings. So I thank you for your time today.
Wonderful.
It's been a pleasure.
It'll be a very good one in Las Vegas.
It will be, yeah. I think I've got my eye on that one, so I will look forward to meeting you there and taking our conversations and hopefully relationships to a new level. So
great, I'd love to.
Appreciate your time today, Dr. Judy, and have a great afternoon.
Thank you very much, and drop the Dr. Judy, please.
Will do.
Ken is great, just never Kenny.
All right. Well, Ken, thank you for your time, and look forward to speaking with you again.
Good. Take care.
Take care. Bye-bye. Hey, thanks for listening to the show. Be sure to go to our new website where you can learn information on how to save on implant products and upcoming CE events. We've got some vendor partners we're working with and a new partner program that we're launching, so be sure to sign up so you can get all the information about the upcoming specials. Thanks.